Okay, I'll share my screen in a jiffy.
Mhm.
Okay, welcome everyone. Hopefully you can see my screen now. Yes, I think you can. Welcome everyone. I'm really excited to be here. I don't know why my video is not showing, but hopefully I'll rectify that very soon. So, okay, yeah. So welcome everyone. I'm really excited to be here. Welcome Ilyasu, our guest.
Thank you.
It's been a while. So
Yeah,
welcome
good to see
everyone.
you
So
all.
before we go for that, really want us to, yeah, don't worry, we're going to get to the introductions.
Mhm.
I want us to share on our social media handles, reach out to people, let them know that we've started. We are really going to have very insightful conversations this evening, and I believe that is a conversation that is going to continue. I will lead to continuous engagement. So welcome once again. For those who are joining us for the first time, I'll just give a brief overview. My name is Chidinma Oli. I'm a research associate at Helpman Development Institute. We are Helpman. We operate as a think tank. We focus on public policy research, analysis, and engagement. And this is one of our arms of extending to engagement, getting to let people know what we're doing, how far we've gone over time. Our mission is to strengthen the nexus between research, industry, policy, and development, kind of like forming a bridge. It's easy to think of nexus and think of so many things, but really the core focus is to create a bridge because we observe a gap in these areas. So we're trying to create a bridge that would reduce the gap between research, industry, policy, and development. Our vision is to be a global development institution, and if you want to know more about us, catch up on live updates of what we've been doing, how far we've come, what we're yet to do, you can check out our website and then follow us up in our different social media handles. So before I continue, I'll just do a little bit of housekeeping. Please encourage us to turn our mics off while the presentation is going on. If you have any questions or if you have comments, I'd love for you to drop that in the chat box. I'll be looking at the chat box and then I'll ensure to let our speaker know about the questions you have for him. And so Elias is going to come up. He's going to have different present his insights, and then there'll be time for question and answer. So if you have questions, answers, comments, just keep them coming in the chat box. I'll be monitoring them. And yeah, I really look forward to an insightful conversation. I will hand over to Ilyasu, and Ilyasu, please, you can go ahead.
Okay, sure. I'll just share my screen before I start.
Oh, sure, I'll stop sharing now.
Okay, I'll share. Just give me one moment. Okay, I think now you can see my screen. Yes, please confirm that you can see my screen.
Yes, I can.
Okay. Okay. All right. Just let me finish this setting. Okay. Yeah. So, good day, everyone. Good evening, good afternoon, and then welcome to this webinar. I think this is the first webinar we had so far as the Institute is concerned since the establishment. So it's also a great honor for me and privilege to be on this webinar. And then maybe before I proceed, most of our colleagues here know me, and then for the sake of those that maybe this is their first time of seeing me or joining. My name is Ilyasu, yeah. So yeah, I'm also a training associate at Helpman Development Institute. Yeah, currently rounding up my graduate study here in Poland. Yeah, so that is just a brief introduction, I can tell. So our topic for today is insight from Nigerian population projection. This is one of the efforts that Helpman Development Institute is leading in order to address the data gap that we have in Nigeria. As we all know, one of the development challenges we had in Nigeria is the data issue. And in data issue, the problem is the population numbers. So we don't have those scientific approach or available data that will be used as the basis for planning and other interventions. Yeah, so that is why we came up with an idea of addressing this data gap. Is first of all addressing, developing models of population projection. Obviously, population census is something that is very cost and also time consuming. Even in the developed countries, you see that the standard population census interval is like 15 years, yeah? So within this period, we need to know what the population will look like. For example, if we have a census this year, then in the next 15 years, what will the population look like? And that is why we project populations, because during this interval, we have to, planning must be done in the country and other stuff. Yeah, so yeah, that is it. Okay, I'll go to the next slide. Okay, yeah. So here are the plans for today. We are going to look at the overview of Nigerian population profile. Then we look at national census. We look at the population itself. We look at population projection by National Population Commission. We also look at population projection around the world. Then we introduce our own models that we develop. Okay. Yeah, so Nigeria, obviously everyone knows, or let me say, most people know that it's the most populous country in Africa and is the 7th largest in the world. And it was projected that Nigeria will be the 3rd largest population by 2050. And this is based on the United Nations projections. Yeah, so, but we can see, even if we look at the observed fertility rates and the mortality rate, we can see some improvement in the life expectancy, and also decline in the fertility rate. So despite all these factors, we still predict Nigerian population to be increasing. Yeah, so if it's going to be like, for example, 3rd largest in the 3rd largest in the world, it means it's increasing geometrically. Maybe it's going to be like two or three times the current population we are now. Okay, so that is as far as the country profile and population structure is concerned. We look at some population pyramid. This is basically what shows the population of Nigeria by age and sex. And I had this data, okay. I get this from 2000 census, so this is easy to generate this population pyramid. We also have 2022 population pyramid. Yeah, so this 2022 is based on the National Population Commission. So they do some projection and then come up with this population pyramid. So this is just to have an overview of how the population structure look like. As you can see, we have, like, at the very base, at the very bottom of this pyramid, you can see we have people that are age 5 to 9, that is children's. You see, this is very high, and that is telling you that there is high fertility rate, yeah, because number of newborns babies. We have a very high number of newborns baby and very high number of under 15, let me say, under 15, yeah. And you can see the old age population, how it looks like. Yeah, so it's shrinking upward. In 2006, it looks like it's increasing at the very end here, but here it shrink. But this is also, if you are to analyze this, is questionable, because when we expect improvement in life expectancy, that is, people tend to live longer, it means we should have much more number of old people compared to what we have in 2006. Yeah, so this will analyze all this yeah, in the coming slides. Okay, so now census. We know in Nigeria, National Population Commission, they are the one responsible for census. They received this mandate since the establishment of the of the organization. So then after then we have the first modern and carefully planned nationwide census in 1952, 1953, with total population of 30 million people and 2.1% growth rate. So this is the result of the total number of people in Nigeria according to the census of 1953. And we had a growth rate of 2.1%, yeah, annual, okay, per annum. Then in 1963, we have also census, and the result is 55.6 million people and growth rate of 5.6%. You can see a high increase between 1953 and 1963 census. And in 1991, we have 89 million people and growth rate of 2.6%. We can also see decline here in the population growth rate between 1963 and 1991. And in 2006, we have 140 million and growth rate of 3.2%. Yeah, so looking at this structure of how the growth rate is changing, is fluctuating, is also something that whenever we are doing projection, we need to put those information into consideration, and we'll discuss it soon. Okay, now we look at determinant of population projections. Population growth. What determines population growth? When we say this population is growing or is not growing, what actually contribute to this population growth? And these factors are very, very important whenever you are developing models of population projections. The first item we have here is fertility. Fertility is very important factor of population growth. It's telling us the information about birth rate and all other related information that concern birth. Then we have mortality. Mortality also tell us information about death, life expectancy and stuff like that. Then migration, we all know the word migration, so it's like the incoming and outgoing of people from whether it is urban to rural, rural to urban, international migration, interstate migration, and stuff like that. Yeah, so depending on what exactly population we are projecting and what migration we put into consideration. Yeah, and also we have a level of educational attainment. This is the idea that recently incorporate into the population projection models. Yeah, because we understand that by the time we have people that attain high level of education, many empirical data, historical data, shows that the higher level of education community have or a particular person have, the lower the fertility rate so that community will have. So this is kind of a factor, is something that is justified based on the historical data. Yeah, and of course there are scientific even evidence that address this one. So we decided to incorporate this level of educational attainment into our model, and we can see the results. Okay. Yeah, and I can tell you that recently most of the population projection around the world, they don't consider this level of education. Even if they do, they don't consider it directly, but rather indirectly. For example, just considering the fact that it only affects fertility rate, yeah, and then apply some expert opinion and stuff like that, and then make their projection. But IASA, this is International Institute of Applied System Analysis in Australia, which based on this work, we have reached out to them to actually understand how to incorporate this level of educational attainment into the models. Yeah, okay. Now we look at the total fertility rate. This is just some information I get from a graph from National Population Commission, this concerning this life expectancy. Now looking at this graph, we can see in 2006, we have 51.7 It means, what this means is that people can live up to this year before they die in Nigeria. That's what it means. Yeah. And then we can see that the life expectancy is increasing, across the period. The highest we have here, 56.2. So this life expectancy is just like the average of both men and women. So yeah, but we understand that life expectancy among women is higher because men are more exposed to some natural stuff, as them and stuff like that. So the chances of them dying earlier is considered higher compared to the women's, and maybe other biological factors that I don't know. Yeah. So okay. Now we look at this total fertility rate. As we can see also, is also declining. As if you look at across the period, is declining. And this is based on NDHS, the National Demographics Survey data we have in different interval. We have the total fertility rate decreasing. And this is telling us that if this is happening, definitely the population growth is going to also decrease. Yeah. Okay. Now we look at how National Population Commission of Nigeria project population. As we can see, the Nigerian government through the NPOPC adopted mathematical trend extrapolation method in making population projections. Yeah, so this is the method they use. This method, of course, is one of the methods that is being used, that is used globally, I can say, but it is used mostly in countries where there's a continuous census and there is good data storage system. In general, there is available data. So by the time we have enough information and timely manner information, of course, we can apply these models to project population. Yeah. But for the case of Nigeria, no, I doubt if this works well. Okay, so these are just some basic mathematical formulas. We have the first one is the exponential, we have the geometric, and then we have the linear. And the last one is the linear. So a fixed 3% annual growth rate is employed to achieve this projection, a highly questionable practice. Yeah, so that is the issue here. This 3% growth rate, because we have R in the formula all through, you can see we have this variable R, and it means the growth rate. So it's based on this growth rate that we just put and then get the future population. Let me just explain one of these formulas. We have like P naught here. P naught is the population, the current population. If we know, for example, we have 2000 census, we put the current population, we put the growth rate, then we put the interval for which we are doing the projection, and then that is T. And normally we use 1 year interval, and it gives the result. Yeah. So fixing this 3% annual growth rate is the question here, because as we can see from the previous slide, we can see how fertility rate is changing. We can see how life expectancy is changing. Though we don't have much information about immigration, but we know that these events are also dynamic. Immigration is something that is changing as well. Level of education attainment is also changing. So fixing this 3% to project population is actually not a good practice. Yeah. So, and then we'll justify it more in the coming slide. Yeah. Okay, so why is this practice questionable? This of 3% growth rate may not give a true presentation of future, because the growth rate of any population is affected by population determinant, such as fertility, mortality, migration, and level of education. So yeah, I just mentioned this. Observed fertility rate has increased while mortality has declined. We just see from the previous slide, due to general improvement in healthcare and other determinant of health. So yeah, this is just some insight that why this even mortality decline. If we have improvement in the healthcare sector in general, we'll have people have access to good health, when they are sick, they can go to hospital, you know, so it's easy for this life expectancy to improve. Yeah, just give me one moment. Sorry, I need to. Okay, yeah. So yeah, we'll move to the next slide. Okay. So here is also another back of, according to the estimate derived from the Nigerian household healthcare survey. This is a survey that is usually conducted in Nigeria. There are variation in percentage distribution across different age groups. Now, let us take a look of this table. We have the National Living Standard Survey, we have the Household Survey 2007, then we have the 2006 census. Now, looking at the proportion of people of different age group and sex, we can see we have people age 0 to 4. According to the survey, we have in 2018, they covered the 17% of the entire population, and 2007 household survey shows that 14%, and then 2006 census also indicates 13%. The same thing applied to people aged 5 to 14. We have 25%, we have 29%, and we have 28% respectively across all these surveys. So this shows that there's actually a great percentage variation in the percentage distribution across different age groups. So with this, it's also not justifiable to keep the growth rate constant. Okay. Yes. Okay, yeah. So now these are the shortcomings that we notice in the Nigerian population projection methodologies. So the shortcomings, together with the desire to provide focus, not only total population size. I mean, if you look at the population projections, they just come up with exact number of people that are living in state, maybe by age group and sex at a wider range, but we don't have this composition, population segregation, different kind of population group that, for example, to see the dependency ratio, to see the working age population, to see the population maybe that in childbearing ages and stuff like that. So they are not part of the projections. So, and if we really need this information, we have to devise other alternative for population projection, and this data, of course, for effective planning. So yeah, these shortcomings, they limit the effectiveness of healthcare intervention, as planning depend largely on demographic data as well as economic development and poverty reduction initiatives. And in general, the national planning or any other thing that has to do with population data. Yeah, okay. So now we look at population projections around the world, how population projection is done around the world. So the accuracy of population estimate and prediction depend on timely and reliable collection of demographic data, which include information. These are the system of storing data. So going back to censuses, population, household surveys, and other stuff. So yeah, international organizations such as the UN, the US Census Bureau, International Institute of Applied System Analysis, World Bank, project population globally, nationally, and even based on region. So these are the major organizations around the world that project population. Of course, countries project population for themselves. They project nationally. Some countries that have state in them also project based on subnational level, like Nigeria. Yeah. So yeah, so let's see the methodologies. they use population projection method. So the first one, and is very famous techniques for population projection, is the cohort component method, extrapolative method, linear extrapolation, and this is just the one we discussed, the one Nigerian population commission use. And then geometric interpolation, we also mentioned this as part of those ones. Then Bayesian statistical method, models, then expert opinion. So this, like, expert opinion is not like a model, but it's used in order to address something in population projection. For example, when we have information on level of education and we want to incorporate it into our models, some expert might tell us, okay, so if the level of education is so percent, then it decreases fertility rate by so percent. So these are some kind of specialist work. Yeah, but not much justification scientifically. That's why this approach is not actually advisable to use it to project the population. Yeah, so okay. Okay, now coming back to our models, that is when we'll discuss the main approach used, that is the cohort component method. So it's actually, even the United Nations, I know IASA also use cohort component method at some point. Even by the time they came up with idea of incorporating level of education, of course, they still stick to this method, because this method, in fact, take into account all the determinant of population growth that we have. So yeah, cohort component method make projection with a summary of component affecting population change. So those components we mentioned, like fertility, mortality, migration, and education. It requires more effort and data, and it makes more sufficient projection than the mathematical method, as it utilizes the fertility, mortality, and migration across various age groups. Yeah, so that is one of the power, or let me say advantages, of using this cohort component method. Yeah, okay. Now, how do we model Nigerian population? So our modeling in general, we follow the UN, the United Nations patterns of population projection. We can see we take some steps in order to achieve the result. Data availability, first of all, by studying the model, we have to look at the available data we have. If there are any gaps in the data, then we have to devise a means of bridging the gap. Yeah, to make sure that we have all the data that are required as an input into our model. Then the general analytical strategy and step for producing population estimate. So this analytical strategy is the math we do behind the models and other things like that. Then addressing challenges arising from data quality issue, we mentioned this. And then fertility assumption, we need to make some fertility assumption, and then we have something that help us in making our assumption, or in believing that our assumption is actually accurate. That is when we look at the survey data, we find out what fertility rate, what was reported to be the fertility rate within some time period. Yeah, so based on that, we make some assumption and even make some interpolation, because it's easy to do. Yeah, so then also mortality assumption, increase in life expectancy. Although we don't have even the national life tables are projected based on some factors, which I believe there are also shortcomings there, but we also develop our own life table. Life table are easy to construct. Yeah, so life table, these are just based on the probability of survival. So if we have, the most important one is the probability of person of age X surviving to some time T. So if, for example, we consider person age 0 to 4, then we can able to compute that probability. And then based on that probability, then we can get the rest of the information in the life table. So there are some kind of actuarial mathematics there Yeah, so, but also there are tools that can be used to generate this life table, which I think we use some of them. Tools like modpacks, DAFs, these ones they are United Nations developed tools that they use these tools to also construct their own model life table. And then based on this life table, we can have somewhere a column that have this life expectancy. Then we grab those life expectancy for different time interval, and then use them in order to get the results. Okay, so yeah, we now look at the computation, what we actually came up with, or how we do the computation, how we calculate everything in general. So first, we have to get the base year population, which we use the 2006 census as our base year population. Then when you have the base year population, it's easy, you just apply the survival probability to this base year population, and then you should have population T plus N, where N is the number of the interval that you consider in the cohort or time horizon. So yeah, that is just it here. Multiply each group population by life table, which I just mentioned. Yeah, so make any adjustment for migration. Of course, if we consider Nigeria as open population, of course, we need to put something about migration, which we did, and then calculate the total number of births, because we have just two segments. We have people age 5 and above, and then we have other segment, people age 0 to 5. So yeah, based on this segment, then we get here total number of births. And then by the time you get the total number of births, to get the actual number of people that were born during the time horizon or the cohort you are considering, you need to apply this survivorship to this number of births. Then you will have the actual number of these things. So these are just some kind of model explanation. Yeah, you might not see it clearly what I'm saying, but by the time you happen to lay your hands on this model, you'll be able to understand what's going on. Yeah, so in the end, putting together these two segments will have population result at time T plus N. That's comprised of all the age group and the age, and sex. Okay. Okay, so now this is how the result look like. We have put the result into different segments: population aggregate, population structure, then the rate of change of population. Population aggregate, we have number one, estimated number of people that is in total by age group and sex. Then we have the young, we also have somewhere the young age population. We have the school age population. We have the working age population. We have the women in childbearing ages. We have the mid-interval population size. We have population growth. We have number of birth, number of people that die, and number of people that live within that time horizon. For example, if we are considering 5 years from 2006, for example, 2006 to 2011, yeah, that's 5 years. Yeah, so we estimate the number of people that live within that interval, and even the number of people that die within that interval, and the number of women that are in childbearing span. Yeah, so all this, they have all this aggregate has their own definition. There's a way they were defined in demography. So based on that, we extract them from the data. Then the population structure, this one is also important segment of population projection result. We see proportion by broad age group. It means we see proportion of young age, proportion of working age, old age. Then we calculate dependency ratio. We also see old age dependency ratio, and then the total dependency ratio. By the time we have idea or insight of what this look like, of course, planners, policymakers will know what to do when it comes to national planning and other related activities. Okay, Then we have the rate of change of population. So this is important. We'll be able to understand the crude birth rate, the crude death rate, and rate of population growth, how our population is growing, what is the birth rate, how it's also changing, and also the crude death rate. So this is how we structure the result of this entire population projection. Yeah. So now I just put some few information just to make some comparison. Yeah. So as we can see here in this table, we have the total projected population from 2006 to 2030. So this is, we have based on mathematical projection, those formulas I mentioned that MPOPC used. Yeah, so if you look at in 2006, we have the same thing because these are the base year population. So we need to put everything the same. If you look at in 2011, that is after 5 years, the population increased to 162 according to the this mathematical formula projection. We have 162 million people, and here we have based on the cohort component method, and then considering the declining fertility, because in this case we have many scenarios. We have the declining fertility, we have the moderate, we have the high. So yeah, this is just based on the declining. Despite the fact that the fertility is declining, we still have a higher number compared to the mathematical formula. So you see we have 167 million people. 2016 we have this. In 2021 we have I remember in 2019, I think, yeah, 2019, Nigeria is said to be 200 million or something like that. I don't remember the number exactly, but yeah, this is based on these projections. So we have, here we have 234 million. We have 2026, this is how it's going to be because this is future, and this is how it's going to be based on the cohort component method. And then we have 2031, 294 according to the formula, and then according to the cohort component, we have 320 million people. Yeah, so by the time we have result, this is 2023, by the time we had census result, at least we have something to back up these models. But scientifically, it's proven to be correct. So yeah, there's no doubt behind science, yeah. So yeah, just a quick summary of proportions. I mentioned earlier I've displayed some present some table that show proportion. We have 2006, we have 2011. Just let it come down. Yeah, so yeah, we have different population proportions. This percentage means we have 16% of the total population are people aged 0 to 4. And in 2011, this percentage increased because the fertility rate is increasing. So in 2016, this percentage tend to decrease, and it keeps decreasing up to this because we see that the scenario we consider here, the fertility rate is declining. So by the time it's declining, scientifically, we must have number of children declining. And coming back to the 65 year plus, that is the old age, we have that, we have 4, we have 4, we have 5, somewhere we have 3, no problem. So you see that because we assume that life expectancy is increasing, that is people will tend to live longer. Definitely the number of the people within this age bracket 65 plus have to what? The number have to also increase. If the number increase, then they will have high percentage of the total population. So this is just some kind of insight of what our projections results speak about. Okay. Okay, thank you for your attention. And I think here are some few references, and then, yeah. Thank you all.
Thank you very much, Elias. That was very, very insightful. I think that's one of the major things that right, specifically from the projection results. One of the key things that I highlighted was the differences in our projection results compared to that the NPOPC has been doing over a period of time. And I couldn't help but wonder about the policy implications, because ours tends to be higher. And does that mean, I'm just reflecting, maybe that could really imply that in the previous years we've been under planning, right, for people. So we probably have a larger population that what we've been planning for. And probably that would be part of the reasons why we're having issues across different sectors. So it was really interesting. It was quite fascinating, Ilyasu. I don't know if anyone has questions for Ilyasu. You can just raise up your hands if you have questions for Ilyasu, maybe questions, comments. Because I really want us to ask questions, have more insights. Maybe you have thoughts. Maybe you think that our projection model wasn't good enough, or something that we could do to make it better subsequently. So if you have questions, please raise up your hand. I'll be looking out for raised hands. Okay. Emmanuel Vincent has a question for you, Elias. Emmanuel, please, you can unmute your mic and go ahead.
All right, thanks. Hi, Elias.
Hey.
Nice meeting you again.
Yeah, thanks.
All right. I would like to ask if there's like a mathematical model, because I've not seen a slide where you display the mathematical model you're using. So as a mathematician, I'm kind of interested to see what is improved as compared to what the National Population Organization has been using. So I don't know, is there a slide or is there like a name? Common mathematical name.
You're asking if there is a specific name. For example, we have the Markov model, So like this, you say for population projection, if there is a particular name that we have for these models, or what's your question exactly? Did I get the question?
Yeah, you got it. But in particular, the exact model for which figures you display.
Yeah. So like I mentioned, the method is called cohort component method. And I display some steps that we use to achieve this result using cohort component method. But specifically, I didn't include those mathematical equations here, but I only explained them in theory because we have different people distinguished graduate here, So I don't want to put some boring formulas, but yeah, so that is the idea. But of course, when we say a model, is of course mathematical and it involves a lot of equations. Yeah, I'll show you this if.
All right. I think you've answered my next question.
Okay.
My next question would have been, but there are these mathematical models, right?
Yeah, of course. That's why we get the result.
Okay. And then lastly, my other question is I think the third to the last slide. If you could move backwards.
The last slide. Okay.
No, the third to the last.
Okay, sure. I will just go to the top.
Yes. All right. So if I were to use maybe Python or any other suitable mathematical software, and I plot this as graphs, what shape or what curve do I expect for the CCM modeling? Is there any observable shape or pattern that I would say?
This is a matter of distribution as far as I understand your question, because you need to look at how the population look like. Then you have to, first of all, think about some distribution that fit this result. Then, based on that, you can plot, because of course, if for example, you assume this population is exponentially distributed, then you can plot it exponential, but it might not give you the good picture of exponential if the data does not fit exponential. So it depends, it's left for you to do some goodness of fit analysis. There's what we call goodness of fit analysis. And there are many things we use to do goodness of fit analysis: chi-square method, homograph approach, AIC, PIC approach, and stuff like that. Yeah. So based on that, you can be able to plot and then have more idea. This is matter of data visualization. And I can recommend maybe using any library you want to either use R or pandas in Python or whatsoever. Yeah, but it's not actually, I can say the most important thing here. So the important thing is to have the numbers and see what they are. Yeah.
Thank you very much, Ilyasu. And just a little comment on your previous comments on saving us the mathematical formula. I think that was good for particularly for some of us. So Chisom, you had your hands raised earlier. I don't know if you still have questions. I know Paul's hands are also raised. So Chisom, do you still have a question? You can go ahead to unmute your mic.
No, Emmanuel has asked some of my part of my question, and it has been answered appropriately. Thank you.
Thank you.
Okay, thank you very much, Chisom. Paul, please go ahead.
Good afternoon. Can I come in?
Hey, Paul. Yeah, good afternoon.
Yeah, thank you for the wonderful presentation. Although I was trying to look at your projection, your CCM projection, and corresponding it with, although there are other projections, like I was trying to make reference to some other online projections, such as I think I was trying to use statistics of time, the projection, comparing the projection with yours. The difference was high with yours. You are having a very large margin compared with some about 2 or 3 online projections, which I have also checked. So also your baseline were similar, but your projection was high. So please, can you explain the reason or why you're having bigger population size compared to theirs?
Yeah. Maybe before, sorry, let's skip this slide. I need to go back to it here. Yes. Okay. Before I ask you, before I answer your question, I would like to know, you said online projection, right? Is this information you get somewhere, or where do you obtain this online projection? And is this projection about Nigeria? And if it is Nigeria, is it national or subnational?
Yeah, like I make reference earlier, was saying I checked statistic time. That's yeah. So their projection was
so
not as
it's a website and it's official website, right? Like National Bureau of Statistics or something like that.
I didn't get you.
I mean, I just want to be sure of the source of the information, because people post different stuff online, and so if you are not careful and stumble on the data that is inaccurate,
so, but like
you shouldn't stress on finding why.
Yeah, like I said,
that's the reason.
Yeah, you have a similar baseline. That's the question.
So I have a similar baseline. You mean the projection also is based on 2006 census, yeah? The one you see.
Yeah, I'm using the case of 2021 as a case study. I'm not basing on 2006. Your projection shows that we had census 2021, which you use as a baseline.
No. What here, 2006 here, that we call the baseline. So,
yes. Yeah. No, 2021.
This 2006 that we call the baseline is the census result.
Yes.
All other results.
I understand that.
After 2006 is projected population result. So it's not like we had census during this time. Okay. So now the answer to your question is that the reason is that the method, number one, we use different method. Number two, we need to understand what method did they use, because I mentioned mathematical, even this mathematical projection, they have like 3 different methods, although the results are similar because the 3 methods are almost the same, or they are similar in nature. But you need to understand what kind of population projection method did they use. Yeah.
But my final question, do you compare your results with others before this presentation, sir?
Well, if any other people project population in Nigeria, we do many findings. If at all they project population, is based on these formulas. They can have different base here. You can base your projection based on another projection, of course, it's doable. So perhaps
my last question is this: 9 months ago, President Buhari with the World United Nations, things like that, projected Nigeria population to be 400 million by 2050. So with your 320,
you said 2050.
Yeah, with your yes. So with your 320 at 2021, 2031, I think by 350.
Okay, so thanks for this question. Let me quickly answer you, So now, if population projection is projected to be 400 by 2050,
and President Buhari did that.
Yeah. Nigeria is using 3% per annum to project population. And I'm sure if you use 3% per annum, by 2050, it's not going to be 400. And then the question is, what growth rate percentage did they use to project this population? One cannot just come and tell me the Nigerian population, whether he's the president or whatsoever. This is a matter of science, If they said population will be 400 by 2050, they have to show us what growth rate did you use? And why do you use that growth rate? So if it's mentioned that it's going to be 400 by 2050, of course, we need to ask some questions. Based on what growth rate? Because we cannot use 3% growth rate that we are using currently to get 400. It's going to be higher, rather. Okay? So yeah, that is the idea behind everything. So everything needs to be backed up by evidence. In the field of science, we don't say things just like that. They need to be backed up, yeah? I think I have answered your question. It's actually a question,
Thank you.
Thank you very much, Paul. Thank you for the series of questions. And thank you also, Ilyasu, for really providing more insights about that. I think that before one makes any comparison from external sources, it's good to know what was their method, what did they use, and that'll be get to where they are. I think the final question that we're going to take is going to be from Mary. Mary, can you mute your mic?
Hi, yes, hi everyone. That's a wonderful presentation. Yeah, so my question is, where do you feel is the best source of data for projections? And then also, is there any improvement you feel we can make when trying to reproduce the work, like challenges,
As far as data source is concerned, we use authorized data normally. If we want to project any population, we use authorized data. When I say authorized data that has been authorized nationally, for example, looking at the populations, NBS, National Bureau of Statistics, maybe looking at World Bank, UN, and stuff like that. So these are some kind of authorized source that their data are validated. So that is as far as the source is concerned. And you mentioned about improving the what? Sorry, maybe you need to.
I said the question is there any improvement you feel we can make when trying to reproduce the work, like challenges?
As far as this model is concerned, I think we incorporate all the necessary factors that need to be incorporated. So if we want to continue with this model, I think as far as generally around the world, but we keep doing research. If there are any other findings or any other improvement as far as the model is concerned, then we'll try to make adjustments. And thanks for that.
All right, thank you very much, Ilyasu. I think I'll probably tour a little bit further, Ilyasu, in line with Mary's questions. So do you mean that we don't have study limitations? Everything went on perfectly well? Are there probably reflections on things that you think we could have done better? I guess study limitations generally.
Sorry, I didn't catch that. Can you say the question again?
Oh, okay. No, I said I think I'll go maybe pressing further into what so I was asking rather, do you think that we have study limitations? Are there things maybe we could have done better? Are there things probably would have maybe other determinants would have included in the projections? Just your general reflections.
Yeah. I think the one limitation is the education attainment issue, because it's one of the factor, and we have reached out to IASA in Australia. I and OT did that, so we are still trying to come up with the model. I think now I have the idea, so it will come up later. So yeah,
that's awesome. Thank you very much. That will be the last question. Chukwuma, you can unmute your mic and then conclude.
Okay, good day, Ilyasu.
Hey, good day.
Yeah, so I wanted to ask, for this mathematical projection, if, for example, they increase their percentage from like 3% to like maybe 7 or 8, would it be more advisable? Or are you saying that it's something that we should no longer do?
I think it's not advisable to just increase the percentage, because even this 3% percentage, they don't just use it. It is based on the census between 1991 and 2006. You get?
Okay,
so the growth rate between that interval, that is what they are using to grow the population up to this date, which is actually questionable. You can use 1991 and 2006 till now. Many things have changed as far as the determinant of population is concerned. So you cannot just change the growth rate just like that. No, you can increase or decrease growth rate without basis.
Okay. So you're saying the percentage, if at all it should be used, should be better calculated?
Yeah, should be better calculated, and it should come from a good source. In fact, based on population projection, if you use cohort component method, you are not going to, because population growth is considered to be, as far as projection is concerned, an end result, not the base. So if you use it as input, means it's supposed to be very good. It's supposed to be from a reliable source. But if you use projection cohort component method, in the end, you will calculate what growth rate should be, not you use it as an input to get what the population will be. You get? Yeah.
Yes. Thank you.
Yes.
Okay, thank you very much. Ilyasu, thank you so much for that insightful presentation. And thank you everyone who tuned in or joined us. Thank you also everyone who asked questions. Unfortunately, we've come to the end of today's webinar. Thank you once again, Ilyasu. So just a quick one. We're going to be sending surveys just in case you have further questions for Ilyasu. I'm sure, Ilyasu, if you could maybe put your LinkedIn profile on the chat box so people can always reach out to you. And
I don't know how to wait.
okay.
I have to struggle to find it,
No, it's okay. It's fine. It's fine. We'll probably include that in the survey question that we're going to send. So thank you very much, everyone. And we look forward to having you in subsequent webinars. If you have questions, if you feel that there are things that we could have done well to facilitate the process, please don't hesitate to put that in the webinar. And see you next time. Have a wonderful day. Yeah. Bye. Thank you so much.
I'll stop recording. Thank you all.
Bye-bye.
Bye. Where to stop recording?